In high school, I was pretty nervous to talk to people. It was like that because I was an introverted person, always looking down, and I would always hide my face and staying to myself. I work at the inpatient pharmacy here at Austin Rochelle for Project Search. 4, 5, 6, 7, 8, 9, 10.
Project Search helps people that have some form of disability, but they still have opportunities for a career, and we're able to teach them a job function. It gives people an opportunity that they would not have otherwise.
When I first met Stephen, I was thinking, how are we gonna do this? This is gonna be a hard road.
He was very quiet, did not make eye contact. He would keep his head down.
He had to be pulled into conversation, and even then it was one-word answers.
But my team quickly embraced that. Our pharmacy functions as a family. You know, I had team members that would look at Stephen and say, all right, make eye contact with me, smile when you're talking, speak up.
Working with Stephen has taught me to be better with my communication, because before Stephen, I had my own shell that I had to come out of. And we kind of chipped at each other's shells, because if he had a question, he would come, he would ask, and I had to answer that question. So that helped me while I was helping him. Yes, sir. That's it.
When he started to come out of his shell a little bit and he started to learn different job functions, he was proud of what he was learning. He would go back and tell his preceptor, hey, they let me do this today, or I learned this today, and he was real proud. And we would continue to grow that. And we had limitations, though, because he wasn't licensed.
In high school, I wasn't really learning new things in high school. But until I got to Project Search and started working at pharmacy, I learned a lot of new things.
We knew if we can work with his preceptors and help him obtain his pharmacy technician license, we can allow him to do other things like deliver a medication to a floor. So his preceptor was able to help and the pharmacy team helped, and he was able to obtain his pharmacy tech license, which was a tremendous accomplishment for him.
First, it has given me the confidence that I will need to get a job and show people that anything is possible if you step out of your shell. They asked me for this aspirin.
Mm-hmm. Is that easy?
Yeah.
Now he has learned his way around the hospital. He is delivering with no supervision, smiling, eye contact.
You're doing a good job. I'm proud of you.
Thanks.
I'll never forget when one of his preceptors came in and he was standing at the counter in the pharmacy with all of our team and he was laughing, and they said, oh my goodness, this is not like him at all.
They've helped me be more independent and helped me talk more. And Project Search has helped me look up a little bit more and be a little bit more confident.
Now is total interaction. Can I learn this? What can I do next? Can you show me how to do this? He is on the complete other end.
Ochsner values of equality and being able to provide opportunities to everyone this embraces that. For people like Stephen, for other team members of Project Search, you're able to help our community. We can now offer Stephen a part-time pharmacy technician employment opportunity, which he's very excited about, the hospital's excited about. We absolutely want to be able to offer that for him.
And I do think that Stephen is something that we needed, that we didn't know we needed, that brought everybody together. Stephen is a part of our team.
You did excellent.
Thanks.
Give me a ball. You did great.
All right, Stephen. You made me happy today, you know that? Meeting you.
Thanks.